Hello, everyone. Welcome to the Pain Podcast. I'm Tim Beams, and I've got Bart van Buchem with me today. We're going to explore something we've touched on loads of times, actually. Today, we're going to explore the idea of playfulness, bit of creativity, some variability, abundance, and figure out what or how we can place that within the framework of rehab and persistent pain and things like that. So and just recapping on a couple of the previous episodes that we've done, we've talked about agency and shrinking worlds and affordances and how we want to expand possibilities and things like that and regain sense of self and my thoughts are that incorporating some ideas around now playfulness, I guess there's as a word it might be nuanced as well. So maybe that's something that we can talk about first of all, because I'm just thinking playfulness. It's not necessarily being silly, although having a bit of fun.
I wouldn't mind having some
might
fun.
Might be a lovely thing to incorporate within a treatment setting. Yeah, first thing I suppose let's sort of get into the nitty gritty and like how do you feel about bringing just a bit of fun and play and enjoyment and maybe tipping over into a bit of silliness sometimes might feel for you in your clinic?
Yeah, I think that the fun encounters are usually the ones that stick with you, and they do seem to have, I would say, from my end, makes my work more fun to do. As I rarely get people sitting in front of at me, they feel great or they having fun or a great life. So not being me, the clown or whatsoever, but we have a little bit of a laugh, and I think it, in many ways, it's another coping strategy to break some of the tension or even create some opportunities there, building trusts. But obviously, it has to be appropriate. It is not everything is funny. Although I remember being in the department where people were basically sort of dying, and there was a lot of laughter. That was one of those strategies that people were going through, having kind of. It made it a bit awkward, but I think having a laugh or play just is like super important. So I don't think we should over the ages. So if you can historically, or not even during our lifetime, I think we start with 90% is play and 10% is quite serious. And I think it's how much do we play? So it's a decrease of play and an increase of, I would say, seriousness in many ways. And it's even hard because it's so much as how life evolves, right? So we are losing the ability to play in a way, and I think it's not that we all should do like 50% play and 50% being serious, but I do think it's a feature that it will be harmful. Losing it, yeah.
Yeah. And that sort of immediately makes me think about the difference between treating children or adolescents and then treating adults and then older adults and how that might shift and change dependent on the people, the expectations obviously in front of you. But yeah, so I'm just coming back to a bit of playfulness. I mean, it's, when you're treating children, actually, it's not, I don't know, in my experience, it's not been a difficult thing to slip into. That's quite, sort of expected then, and a bit, there's certainly not so much resistance. There's a bit more of a sort of openness there, isn't there? Is there the same when we incorporate that into adults, and what's the risk there of opening up a bit of playfulness and creativity with them?
It's a good question, isn't it? It depends, I guess. But it's all about the gut feeling. I think this is where the human connection is so important. If you don't tune in with your patient and they are absolutely not after a laugh, or they're not in the mode or mindset that requires that, that probably is inappropriate. Although I think making a little bit of fun also could radically change that. But it also should suit your appearance. If it doesn't, if you're going to be the funny guy or funny person that you're not, that's probably felt, right? I guess that's something. But I'm not saying laugh for, and I think it's probably that's a good question. Where when is it appropriate? Is it just being creating a laugh or fun because it has to be fun, or is it something like really functional and it relates to the situation? I think I would genuinely feel more comfortable when it's related to the condition or the situation and where you end up in. Uh, I often say people that walk very slowly is that I would carefully take this corner because you might sort of lose direction and you might hit the wall, for example, as a little fun thing to say. And they're walking with their rollator. Is it the same thing in
Yeah,
English?
yeah,
Yeah.
yeah, yeah,
Yeah. So, oh, don't go too fast. You might miss the corner. Like, and they're pissing themselves. I kind of have that little fun things that could break the tension a little bit.
yeah,
That's
yeah, yeah, yeah.
um, not sure whether that's just fun and creativity within the clinical setting, but I think this is sort of the tone, just setting the scene for, all right, you're allowed to make jokes and you can have a bit of fun. If not,
Yeah,
that's
yeah.
fine.
And then I guess there's a sort of alternate way of thinking about playfulness there as well, isn't there? Of experimentation, exploration, openness as well,
Mm. Yeah.
which we've obviously discussed in some ways with relating to affordances, relating to the predictive processing models as well of opening up possibilities and opportunities. So yeah, how would that look in your clinic when you're asking someone to open up, if you want, and be explorative and creative as well?
Um, I think it starts with observing from basically the waiting room to the treatment room, if you like, or observing people what they actually can. And you might have, I think this is a very specific clinician or ability you have to see what people's ability are, and therefore, and they might be having feeling constraints of doing that. I'd rather, even during testing, for example, or if you you're basically gonna, when you do the assessments, within the assessments, you could do something quite unexpected that allows people to stand up in a different way or bend in a different way or walk in a different way. I offer it's not even, especially within the F&D background I have, do you see that people can benefit from different walking and movement strategies that what's called like metaphorical moving. So basically, you walk like you're missing the bus, or you walk like you're being you're being whatever, trying to tell someone they missed they lost out their keys or whatever, or it's just creating a little metaphor, whether they can start embodying that, and therefore you can see different movement patterns. And this is where I see a very strong, I feel very comfortable doing that. um, the other way is distraction. Also, that trying to stand up without thinking about your back, but I want you to think about the breathing, or think about how you basically push your legs away instead of standing up, because these goes with, and with even with very little instructions, you can see people do different things. You can reflect on that, and sometimes you can extrapolate that to other conditions. Let's see how this works, or um, and I think there's a little bit of play and creativity involved there, because you can get people do things in a very different manner. And I think this is where change and therapy is going to be quite. This is where it starts, like, be from fun, and creativity is actually a therapeutic approach, because it changes it, and it gives people a different experience, a different feeling whilst they're doing it, and they controlling it. I
Mm.
think that's very important. But
And
even yeah,
yeah, and with that, what are you doing? Are you specifically asking them to notice or to feel, or what are you doing with that
yeah,
person in those moments?
yes. I think you as a clinician already being there doing it together is already a very big shift or a change compared to, let's say, the average or the more common situation. So even say, I want you to do this, and try to meet, not to print, I'm not in the room. Even that little sentence, it's a very hard task, but it gives you an idea of how people are actually controlling their movements, and how their expressions, and how they feel about it. And this is actually what you want. You want to have, I think, from a clinical point of view, you'd rather have a control state, whether they do it without any instructions, and this is how they perform in this certain situation. It gives you an idea. And then secondly, you're going to start introduction. So my first instruction will be the least instruction, to get the most, let's say, clear idea of what their strategies are. So if they bend, you just bend, you whatever do. Or if I'm going to push someone on the shoulders to bear the weight and see how they respond to it, that will be without any instruction. I just want you to do it whatever you think is right. You can always say no, or I feel comfortable. So give a little bit of safety, but at the same time, just let them do what they do, and then reflect on it. And then putting them then in these newer, or I would say, alternative ways of, or destructive ways of movement, or going through this very similar assessment. Even a straight leg raise test can be different massively. So I love to play around with this clinical reasoning, but also at the same time playing around with context and understanding, um, and then reflecting back. So this whole, um, I would say that this whole assessment and clinical reasoning is embedded within using play to see how people go about it, instead of taking the SLR, so the straight leg raise test, so that's on whatever is 70 degrees, then it hits the back. So is it changing while we're doing it? So it gets you so much more information about how people do cope with their experience, and how they cope with the condition itself.
Mm. Yeah. You mentioned constraint-based um, learning as well in a previous episode. So
Mm.
I would say that's a beautiful tool that we can bring in here as well. Could you give us an example of how that might look yeah, I mean, whether it's F&D or
Could
or
be
not?
anything. Yeah. Well, a constraint, close your eyes. That's a constraint. You have to bend, but you're not allowed to open your eyes, or you're not allowed to, or using only one. So standing up without using your hands. It could be that small, but it's constraining something different. They would normally constrained by the pain, or the expectancy that there will be pain, or their bodily responses that are restricting them for doing it. And they're very aware, and they're focusing on those. So bring in basically a new constraint, facilitates motor learning and new motor skills. And it can be very important to manipulate the practice environment using task constraints to address the factors that actually restrict their exploration. So it's a really interesting thing. I love when you can see different strategies, and actually, well, you can do that. That worked out pretty well. Um, and actually, it doesn't have to be rocket science. Sometimes just while do this while you're put your finger in your ear. Could be anything.
Yeah. Yeah.
But that's probably where it's a balance where you can sort of find people the safety. They need that safety, and then being able to explore, because it's very unlikely that people will start learning if they're not feeling safe. So this all comes down to what I see, where is a balance where you can be like a little bit challenging, but it should be safe. And otherwise, people will probably say, "Well, I'm not going to do that," or "This is not going to work," or they're going to probably fall back basically on, yeah, they're basically going to sort of trust on old strategies again, and they use the old constraint, and that's the back pain, for example, in terms of um, using and focus as well, because that's probably that's where they got really stuck into. Yeah.
Yeah. Yeah. Yeah. Yeah. And then, yeah. So we've got a few sort of ideas of the rapport and bringing a bit of fun and playfulness in that respect, but also then the exploration and how we might go
Mm.
about that. Another sort of element that we were going to talk about, which I feel fits here, is creating some creativity and some variability as well. And I think those, I don't know, I'm imagining those two are sort of could dovetail together, but what would be different? What are we thinking about when we start talking about being creative? Have we done that in, the playfulness, or is that something beyond that as well?
Probably something beyond that, I
It's
guess.
just a leading
Uh,
question, isn't it?
that wasn't the question, though.
Yeah.
Uh, um,
Should practice my questions, shouldn't I, Albert? Sorry.
what was the question, to be honest?
I was thinking about creativity. So I suppose let me give you an example of where I'm going with it in my mind. So we've talked about us helping to guide, but I'm wondering about the autonomy of that person being able to be the problem solver and decision maker.
Mm,
So I'm wondering where, to me, creativity and variability. Creativity is opening up if you want, the landscape, your field of affordances to see what's out there in the landscape that you might not be doing already.
mm,
And we can obviously help, we can guide, we can suggest some ideas, but in my mind, there's nothing better than that person coming up with a bunch of options,
yeah.
and suggestions. Um, Variability is then the ability to not just come up with one, but be able to come up with many, and those alternates. So they might come up with their own constraints, or they
Mm,
might come up with their own shifts in the contexts. I mean, thinking about people I've got at the moment, like creating the environment. We talked about environmental enrichment, to like setting up the environment in different ways might be a way of creating a different experience as
no.
well.
Yeah, and it's when interventions are embedded within uh, within the play or the creativity, or even finding variation. It's the underlying mechanism. I think it's a way of thinking, how you think, how learning occurs, rather than therapy. Therapy, in a literal sense, is doing something to someone. In a way, it's. I think this is how it mainly is understood, but I think treatment, as we see it today, as the most effective way, is where people start doing things differently. So it's all about behavior change, but understanding differently. So you can understand it. You got all this information, but how does it lead to true understanding plus feeling? And it requires that step by step approach in as a framework, because learning doesn't happen by stepwise approaches. You can There's a lot of theory out there But I think we just have to understand where people are at that stage, where they feel how you can facilitate change. And I don't think you need like a very step-wise approach, but it's like experience will be trying to nudge and trying to see when there's something happening, you can see it, you can feel it, and that's probably where you can let the patient explore himself. So I think this is related to the affordances mention you did already. Uh, when people don't or do not have the affordances, so they cannot come up with anything that is related to this. And I think even putting them in a place where they have to come up with ideas, it's can be distressing. So in this or in that regard, I believe that we might need to help them taking that first hurdle, and then they can explore around and create some variation. So it might be, as a clinician, you have to allow them to like another step in their exploration of affordances, and then you probably try to get the patient doing the variation, trying to expand it on different levels and different contexts, instead of you keep giving all these information. Oh, you can do this and do that. I think, yeah, but the first step probably is the step from the clinician that is required, because the patient does not have the capacity to think about something beyond their problem and the way they solve it this stage, which is not always helpful, but it's as good as it gets. And within their world, their understanding, this is what is possible, and everything else is not an option.
Yeah, yeah. You talked about learning theories, and you know, learning also requires consistency and repetition as well. So, um, how do we, we're suggesting that playfulness, creativity, variability is helpful, is important in moving forward with someone who has persistent symptoms, pain, fatigue, whatever it might be. But where do we sort of bring a more traditional rehabilitation sort of rep sets progression? How does that sort of come into this equation as well? And I suppose, sorry, that's a big question already, but I suppose I'm wondering, say someone does work with that mindset at the moment in the clinic, like how can we help them to sort of start to bring together the more traditional, um, repetitive, structured program with something where we're saying actually, it's okay to be a bit more playful, unstructured to a degree. It might feel quite uncertain as well, mightn't it?
Yeah, well, depends, I guess, where people do benefit. So if you can, the broader, I would say the how the literature seems to address activity or exercise, it doesn't really matter how on the type of how you actually going to build this up, or as long as you're doing it. So from that sense, you would say probably give people as much creativity and allow them to explore as much as they can and as they feel comfortable with, and be you being a coach, not telling them exactly what to do, but just let them explore and come up. And if they come up with what I can do, I'd love to do, or like having a more progressive scheme of reps and sets of a certain exercise, I would probably say, great, go for it, and get yourself like a proper advice. Or if you thinking about doing it yourself, just start progressively pace it in a way that fits you, or we might come up with something. But there are people, they don't feel really comfortable with this exploration. They're getting really distressed when you tell, well, let's play around a little bit. um, what actually kind of say, well, this doesn't work for me. So they need that. So they're always constantly coming back to you and saying, hey, How many sets should I do? How many reps? How many times should I do exercise? And then you need to give them that framework, but also with the uncertainty that people need to embrace in a way. So this is actually, I'm going to tell you exactly what you need to do, and you're probably going to do exactly what I told you to. But also remember that you have to. These are, in my view, these are the people that are trying to fit it in their understanding or their, would say, in their way of thinking, in their brain, if you like. These using these words from being very brain centric, but if it fits them, it creates a safe environment for exploring. They'd rather do it within their constraints of like a fitness program rather than letting them go. It's again, it feeds back to the safety environment.
Can we predict who they will be? Are they more likely to be the more divergent thinkers? Are they the people who want the yes,
Yeah,
no, black,
maybe.
white, right, wrong answers, or is it not as predictable as that?
Yeah, no, that's probably what requires some clinical mileage where you can sort of see what they usually do. But I also want to advocate for the fact that it's not always doing the thing that people would like to do or their preferences, because they are there for you, with you, for change, not to run the same thing again. So it's very likely that you have the same outcome if you go with the same rhythm or the same opportunities and the same strategies. So I think it can be um, seen as a role where people say, I've been doing, let's say, 10 pages of exercises every year, and I'm just adding from this therapist and that therapist, and I was doing takes me like an hour and a half a day to take to run myself through this exercise. One of those challenging, very provocative therapeutic approaches will say, well, we're going to let go of all of your exercise. You're not going to exercise anymore. It's forbidden. It's constrained. For this week, you're not allowed to do any exercises following this route. You're only allowed to do it when you feel like morning. Just get yourself, do some random exercise to get until you feel more relaxed and you feel more flexible. That's enough. And they might get back to you and I say, oh my God, I really didn't know what to do. It didn't work out. And I think that's a good starting point where you can challenge those patterns and these strategies.
Yeah. Yeah. I like that. The idea of behavior change and it might be a bit of disruption in there,
Yeah.
disruption to expectations or norms or whatever that might look. So, do you know what's popping into my head as we're doing this? Is the Charles Spence work with Heston Blumenthal. But
Mm.
do you remember doing the wine tasting with him? And he
Exactly. That was
colored the
good.
wine, and he had reds and whites, and then colored the whites red so they looked exactly the same, and you had to do a taste profile, didn't you? And the color had such a dramatic effect on the experience. Start tasting sort of red fruits and strawberries and black currants and what have you, and tobacco and what have you in there, and then the same wine that you tasted when it was white, you were tasting lemons and melon and things like that, weren't you? And so I'm wondering, we've got some pretty amazing experiments in the perceptual realm of how shifting, changing context can influence your perception and experience, and I suppose this is where we're going with this episode as well. There's a last word that we started with, but we haven't dipped into, is abundance. And I mean, a lot of people will have heard of control. And motor control, for instance,
Yeah.
and I suppose in your life you might have been brought up with the idea of you have a straight back when you bend or pick stuff up, or sit up straight and wear your backpack evenly on your shoulders, and there's lots of messages perhaps that people are exposed to, and the idea of abundance, and it fits well with the motor system, doesn't it? Of movement, of instead of being constrained, we've been using that word, but having abundance, having many possibilities, many different ways of doing things. So, what's what's your thoughts there, and how that ties in with everything that we've said?
Um, well, I think control the word. So just as from like a clinical perspective, there are not that many people that seem to have seeking, or they have been seeking control for such a long time, especially in a chronic state. And they're seeking for more control, 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 control. I would say some of the people, but it's the majority of people with a chronic pain, primary chronic pain, or even a secondary chronic pain, do seem to trying to control some, and you can see the bodily expressions of that. So I always found motor control. I think it's more the challenge of letting go, trust your body. Whether that's possible or a thing, it's the opposite, right? So we learn a lot, especially from our background as physiotherapists. We're learning about control this and control that, but it's a tough part when getting people like, oh, you're doing a lot of control now, so can you try to let go for a bit? And that's where I think is where it really tries. So not say you do like relaxation therapy with every patient, but people seem to lose the ability to just not control. And that's a feature of people. Healthy controls, for example, they're great in letting go. And I think that's a very common feature in people with a chronic pain state that is absolutely a challenge of their controlling and trying to find doing even more control uh, to have better outcomes, which I believe is rarely the case. That more control is going to lead to better results. I think least control, ability to let go, to trust, and automatic movements and breathing, being understanding your body in a way you don't have to alert yourself constantly. It's very common that people don't have that. They do. It takes a lot of energy, right? It takes a lot to go through this alert state all day. And I often get people fall asleep when you take some time for, let's say, recovery. Can you let it go? And like, oh, they actually go straight into a deep, not a deep sleep, but actually they do seem to be very doing well on relaxation. That's a really new experience for them. So
Mm.
it's also exploration, I guess.
Yeah,
Yeah.
yeah, knowing that the body can get into that state. I guess, yeah, I'm hearing a sort of bit of freedom, bit of spontaneity, which definitely ties in with what we talked about with affordances and that lack there, and of what recovery could look like for people. We're running out of time, I'm afraid. So let me do my best to summarize a little bit. So first of all, this episode, we've been talking about playfulness, creativity, variability, abundance. And to begin with, we talked about whether or not playfulness is silliness, and whether it's okay to have a laugh. There's a bit of joy in clinic is lovely, actually, isn't it? But it doesn't mean to say that you're not taking things seriously, and that you're not thinking hard and working hard. But it's okay to let go a little bit, as you were just saying at the end there. Playfulness could mean exploration as well, and experimentation, and we came up with a bunch of different ideas. You gave us some clinical scenarios about how you could do that. Offering a bit of guidance, or asking them to come up with their own ideas, or creating constraints in that as well, just to see what the experience would be like when they do it in a different way. You mentioned a couple of nice ones that I like the idea of. Imagine walking like and I was thinking about, it's often I go to animals. Imagine walking like a tiger, or imagine walking like a tortoise, or something like that. So yeah, and figuring out who those people are who are going to come on board with that it's a skill. But my experience has been that if you do something that's playful and fun and a bit different, and people look like they're not going to go for it, you can be really surprised. Actually, someone would be like, "Oh wow," they try it. They're skeptical, they don't expect it, and it can actually be a little bit of a sort of moment and an unlock.
Absolutely.
So yeah,
Mm.
it's not for everyone, but certainly there are many different ways that we can pull out a bit of exploration and experimentation. We talked about creativity, learning. You think about rote learning, doing something in repetition, do the same thing again and again and again, and actually we need to try different things out, don't we? And kids are brilliant at this, aren't they? My daughter's doing this at the moment with cartwheels. Daddy, look at me doing a cartwheel with one hand, and look at me doing my cartwheel running up to do it, and look at me. And as she's doing all this, she's got lots to do. What happens if I do it on a soft surface and a hard surface? So that's part of that learning, through play, being creative with it as well, and varying the way that she's doing it, and doing it in many different ways, so that she's got the ability to go about her cartwheels with variability and abundance. We dropped in. I just mentioned the Charles Spence work. So if anybody's interested in looking at experiments on how we can shift and change perception through context, he's great. He did that work with Heston Blumenthal and the sonic crisp, wasn't it? Of people eating a crisp and having a noise played at the same time where they magnified or they dulled the sound of crunching. And if it was louder, it felt the exact same crisp felt like it was a bit more, it was fresher, wasn't it? Fresher and had a nicer flavor to it. And so, yeah, check that out. There's some really good work there. And then at the very end, we were talking about abundance, and that fits our ideas around spontaneity and freedom, and what recovery really is for people, of instead of having to control every element of your life, which at a time is sensible for some people, but it's certainly not something that is easy to continue, for further onwards. That actually exploring a bit of creativity and variation could be a really, really good thing. Did I miss anything out?
Not really. No, no. I think we covered it all. I think it would be quite nice to see if we can take this conversation a little bit forward onto, let's say, how one of those questions is dosing it. I was, I think we called about, I think we had a session about dosing, but I think this is a really interesting. How much is enough? How do I know when I do lots of these violation of expectation or creativity? When does change occur and when it's not anymore? So when is there a moment in time we can better just, well, that's we done what we could have done. So when do you stop, or when do you have to push a little bit forward? So I think that will be another subject to explore.
Yeah, nice one. Okay, brilliant. Well, thanks
Wonderful.
everyone for
Thank you
sticking
so
with
much.
us. And as ever, if you like what you're hearing, and please share, tell people about us. Le Pub Scientifique, go and visit the website and sign up as well. So thanks very much, and see you soon.
See you soon.